Hello, dear participant. I, A.S. Kulkarni, welcome you on this presentation Introduction to Clinical Pharmacy. In this presentation, we will concentrate on medication history and the role of clinical pharmacist. Learning outcome of today's presentation are: after completion of this presentation, you will be able to understand the medication history and its significance. Also, you will be able to remember the different role of clinical pharmacist. Roadmap of today's presentation. First, we will go for the medication history. At last, we will see the role of clinical pharmacist. Before moving to the next, here is a reflection spot for you. What is the medication history and why it is essential to record patient history in the hospital? We just pause the presentation, try to write the answer for it, and then play the presentation. Yes, you are right. Let's see. So here we'll see the medication history. So medication history means the patient record. So complete history of the patient from its birth to the death, as well as the diseases, its treatment, therapies which is provided by the hospital. So just remember here, the medication history is an patient record which have the complete history of that particular patient. So each and every patient record is maintained in the hospital. So at any point or any time you can retrieve the information or a medication history of that particular patient. So in a previous, so that medication history which is stored in a files or in a written document, but it become more easier due to availability of the computers. So you can add any history or any record in this medication history of that particular patient with the help of computer anytime, or you can retrieve any time of that medication history with that particular patient or of that particular patient. Okay, so that can be retrieved with the help of PRN number, that is patient register number or patient registration number. But this information which is fed by physician as well as the pharmacist or the nurses after the administration, after consulting, and after dispensing of the medication. So at any time that information will be retrieved with the help of computers. So this medication history consists of the name of that particular patient, its gender, date of birth, blood group, immunization schedule, booster dose dates, periodically affected by any details, that is the diseases, as well as the therapy which is given to that particular patient, as well as adverse drug reaction details if any, hereditary diseases details, self-medication, patient habits, and the drug withdrawal symptoms if any. So all these types of history which is recorded in the medication history of that particular patient. So this medication history helps to the physician, pharmacist, and the nurses for further. So we just remember here, the medication history is nothing but the complete patient record which includes the name, all this information So let's move to the next. Here we will see why it is essential to record the patient history or medication history of that particular patient. Here we will see the significances of the medication history. So after recording the medication history, so this medication history can be used as a gauge by the physician for the therapy. So medication history help to the physician for providing the further treatment to that particular patient. Also here patient compliance for the drug can be studied. So what type of information which is followed by that particular patient, either it is following that particular information or not. So patient compliance and non-compliance of drug can be studied. So this helped physician for providing the further treatment. Also a reason for ADR or allergy can be understood. If any patient will administer the dose and ADR will happen there, so that can be added in the medication history. That should be added in the medication history. So this medication history of ADR will help to the physician to avoid such a type of medicines at the time of prescription of medication to the patient. Also with the help of this medication history, so physician can get the information related to the patient routine life pattern. So that can be studied with the help of the medication history. Also it helps to know the patient current and past medication. If the patient has taken the any therapy previously, so that can be or that is recorded in the medication history. Also if current medication is going with the patient, so that will be known by the physician. So it helps to know the patient current and past medications. Also patient counseling with that particular patient become easier after knowing all the details to the pharmacy. If the pharmacist know all the details of that particular patient, so he will be able to do the patient counseling easier with that particular patient. So these are the significances of a medication history. So it will help to physician, nurses as well as the pharmacists to know or to the further treatment. Let's move to the next. But before going to the next point, here is a reflection spot for you. How clinical pharmacists work in the hospital. What is the role of a clinical pharmacist? You just pause this presentation, try to write the answer for it and then play the presentation. Yes, you are right. Let's move to the next. Here we will see the role of clinical pharmacist. So here we will see the overview. So the first, medication history. So your pharmacist will prepare the case history or the medication history of that particular patient. Also the role with the prescription monitoring. So here it is a very important role. Next, patient counseling for providing the information to the patient. So the information related to the prescribed drugs. Also the important role in patient compliance. So after providing the patient counseling or the information to that particular patient, so patient will adhere all the information. So it helps in patient compliance. So it is very important role. Also, the role of clinical pharmacist in therapeutic and drug monitoring, to monitor the condition of the patient as well as the therapeutic efficacy with that particular drug, and the drug information services to store the authentic information in a DIC and provide the same to the healthcare team. So these are the role of clinical pharmacist. Let's see here. So in next slide we'll see in our details. So the first role, that is clinical pharmacist prepares the case history of the patient. So he'll prepare the medication history also there. Also he assists to the physician and a patient for getting a diagnosis tape, as well as to the nurses for how to administer the dose to the patient, to physician how to select the right choice of medication to that particular patient after getting the complete history of that particular patient, and patient counseling to provide the information related to the prescribed drug. Also, he delivers the options on selecting drug and dosage forms to the physician for therapy to be followed. So he can assist or he can suggest to the physician for writing the prescription or medication to the patient. So patient counseling and advice during his ward. So clinical pharmacist is doing the ward visit. So during the ward visit he will counsel the patient, so like information related to that prescribed drugs and advice to that particular patient. Also the patient drug monitoring of inpatient. So patient drug monitoring, it starts from the writing the prescription by the physician to the patient administering the dose. So it is very important role of clinical pharmacist, that is the patient drug monitoring of inpatient. Also the very important role, that is the detection and a report of adverse drug reaction. If any adverse drug reaction happen with the patient, so he will investigate that particular area, how or for what drug it will be happen, and report to the high authority to avoid such area with the other patient or the same patient. Also he maintains the prescription profile of outpatient, participate in quality assurance program and clinical drug investigations. So here clinical pharmacists participate in quality assurance program to provide the better services to the patient, as well as clinical drug investigation to the government channels. Also monitor patient compliance during his stay in the hospital related to the inpatient. So how many percentage which is adhered, or how many compliance which is followed by that particular patient, either that patient is following that instruction which is provided by the physician, pharmacist or nurses or not. If the patient follows that, so it comes under the patient compliance. If the patient is not followed that one, so it goes to the patient non-compliance. So here the clinical pharmacist plays a very important role in patient compliance and assume care and responsibility for drug regulatory affairs. So these are the role of clinical pharmacist. So it is very important role of clinical pharmacist in the hospital. I thought you have understood this. If you have any question, you can drop your question on my WhatsApp number or on my email ID. At last, thank you for patient listening. Thank you very much.